Okay, now, something a little bit more serious. We are asking, should so-called corridor care be banned from hospitals? 0207 862 2222 for this topic. NHS England has been criticised after putting out guidance on how to safely treat patients in emergency department corridors. Leading A&E doctors have accused them of normalising the dangerous practice, and the Royal College of Emergency Medicine has said that the guidance was nonsensical and out of touch. The NHS say the guidance acknowledges corridor care is not acceptable and shouldn't be considered a standard, but admits that under pressure hospitals may need to make use of temporary escalation spaces more regularly, and hopes that the guidance will allow them to do them in the most effective way. What do you make of this, Henry? Do you think corridor care is acceptable, should continue?
Well, the guidance itself says it's not acceptable, and doctors are furious, but they know what happens day to day in hospitals up and down the UK. I mean, I was looking at some figures. We've got 1,148 hospitals, and we're up to 39,000 beds short. That's 34 beds per hospital. It's normalised already. It's just that we don't want to acknowledge it. This guidance is basically saying we know what the reality of life is on the front line for doctors, for nurses, for staff and patients. We don't think it's acceptable, but on those occasions when ambulances are being backed up in the hospital car park and we need to get people in, it's better for them to be in a corridor than in an ambulance, or waiting at home to be ferried from their house to the car park and then into the hospital. So given all those pressures, we think there should be a minimum standard if somebody is unfortunate enough to be in a corridor. Because you can't magic up these beds. We know the situation. It's just basically saying, let's not have a free-for-all. Let's at least have a uniform minimum guidance for those unfortunate and extreme circumstances, which are happening every day anyway.
It's better to be seen by a doctor than not at all, Carole, even if that is in a corridor.
That's the point. I listened to a woman on the radio the other day who was sat for 3 days in a corridor with her 80-year-old mother, and she and eventually the mother got seen. And she said, and this is what shocked me, she said, I'm just grateful that my mum got seen. I thought, what? No, Henry, I was furious. I thought, if I was with my mum, I would not be grateful that my 80-year-old mum had waited 3 days in a corridor with everything that entails when you're elderly. Why are we accepting this as a standard?
Wouldn't you say, Carole, this is outrageous? I want a minimum standard. Here it is.
But we are, by issuing this guidance, the NHS are basically, they're normalising
But it's already normal, Carole.
It's not normal, Henry. It is not normal, and it shouldn't be normal. People of this country deserve a better healthcare system than one they've got. And please don't tell me that they don't get enough money. They get 186 billion pounds a year to look after countries with bigger health services who pay less, have better outcomes. Yes, they do, Henry.
Many of them. If you go to some of these countries, go to the USA, my God, you don't want to be there.
Do you know what? It is interesting that no one has copied the NHS system anywhere in the world. Do you know why? Because it's paid for solely by taxation, and it doesn't work. Most countries, especially in Europe, they have some form of private contribution into the health service, and they work much better. France has an amazing...
Yes, they still have waiting lists, they still have problems.
No, they don't, Henry.
Carole, can I tell you something?
France, no waiting lists.
If you're in France or in Germany, and you go... No, can I just say this?
You can't.
I've lived in France and I've spent time in Germany.
And I know people who live in France, and there's no waiting list.
All right. Look, Carole, one of the reasons why people often don't come forward is because the 40, 50 or 60 euros they have to spend in order to see a GP, they can't afford it, so they don't go. That's why.
It's not 40 or 50, 60 euros in France. It's less than 20.
And
hang on, and they get it back once they've been seen.
It's a massive bureaucracy. It costs a huge amount.
But it doesn't matter. But this health service does not work, Henry. It does not work.
It works for most people most of the time.
No, that is simple.
On a basic level, what you're talking about is a complete overhaul of the NHS system, which plenty of people call for. 0207 862 2222 if you have a story about anyone having corridor care in your life, or just a view on whether it should be banned or not. What you're talking about is a complete overhaul. That is not going to happen overnight. If you had to go into A&E tomorrow and your option was see a doctor and have a bed in the corridor, or have no bed at all.
Whatever it is I've got, it's not going to be made any better in a corridor. You know why? It's not sterile. It's not dignified. The equipment is not in the corridors. There are no toilets. There is no place for people to get water. And I heard doctors and nurses on the radio discussing this yesterday, and they're actually saying that it is dangerous for patients. It will cause immeasurable harm to patients because it's a thoroughfare. It's not safe. You can't contain infection. You can actually spread bed infection there.
Okay,
there was
Carole.
one. No, let me just say, there's
Okay.
one nurse who says even if you get taken to a ward and you have 2 people with breathing difficulties, you have a problem because most wards just have 1 oxygen canister. There's none in the corridors. So what are people getting? So all we're doing is normalising third-rate healthcare.
What they're saying is this is a situation now. It's a situation
Shouldn't
for
be.
the foreseeable future. Well, the problem is, Carole, we have a huge bed shortage. We have a doctor shortage, a nurse shortage. We've got all these shortages. We need more hospitals as well. That's not going to happen overnight.
We need better organisation.
We reconfigure our
Better
health service every
policies.
5 years in this country.
We don't reconfigure
we
it.
do.
No, we don't.
I remember choice and diversity, Virginia Bottomley, back in
words.
1990.
I just want to go to,
Every few years we
I
do
just
it.
want to go to the calls. 0207 862 2222 is the number, because there's somebody on the line, Alison from East Yorkshire, and you have just come out of corridor care, is that right?
Yes, I was in on Saturday.
Was it as dangerous as Carole is describing it?
Well, the corridors were full. They were using the plaster room, and they had paramedics looking after the patients.
Yeah, dangerous.
Doesn't sound ideal, Alison. What was your experience then? Did you finally get the care you needed?
Yes, I unfortunately have seizures, and it was really a question of waiting to see a doctor. The seizure passed, but I was in corridors, and as I say, in a plaster room. And the staff were fabulous,
Yes, always.
but just overwhelmed.
Yeah.
Alison, what is a
I thought-
plaster room? I'm
Where you
lost
get
on
plasters
that.
put on your legs and arms and everything.
Oh, right, so it was just a room they used to care for patients. Alison, how long were you in the corridor for?
About 3 hours.
Okay, well, do you know what, Alison? That does sound shocking. But then we look at some of the A&E waiting times, and actually 3 hours is not bad.
But can I just say,
No, it isn't.
Alison, would you mind if I asked how old you are?
71.
You know what worries me about this? Because I know, when I used to have to take my mum to hospital a lot in her 70s, one of the most important things for her was dignity. And I think there is no dignity if you have a problem and it's a serious problem and you're having to tell doctors what your problem is. You need dignity and you need privacy to do that as well.
Okay.
And that's why I asked you your age, Alison, because, when we're older, I mean, I'm kind of near your age, so, things happen to us and you don't want the whole world to hear about it.
Can I ask Alison, though? Alison, when I'm assuming the doctors or the medical staff explained to you why you were in a corridor.
point?
And not, well, it is the point because
We're settling for third-rate care.
magic up extra staff, extra equipment, and extra beds. Alison, when they told you and explained to you, what was your attitude?
I was perfectly understanding because I could see how busy they were, and there was a lot of ambulances coming in,
Yeah.
and Hull has only one hospital, unfortunately.
And do you know what, Alison? It also, I think it's an attribute that older people tend to have is you just tend to get on with it. You're just happy, I suppose, to be seen and be spoken to, and maybe that's working against you in this case. But then you were seen 3 hours. Again, as I said, not bad. Alison, thank you very much for your call. Dennis from Portsmouth, what's your view?
Hello there. We can't definitely rule it out. I've had a short experience of corridor care, and just joking about it, at least I had plenty of visitors I wouldn't have had normally.
Visitors, you wouldn't know.
There you go, Dennis.
Again,
Just help boost your mood.
Yeah, also the spread of viruses and bacteria.
Exactly.
Dennis, how long were you in corridor care for? Did you get the required care that you needed?
Well, just a couple of days really, but I went into a ward eventually.
Okay.
But we definitely cannot rule it out,
Okay. I mean, I think the worry is that if we don't rule it out, it will continue, Dennis.
Exactly.
But if you eventually got a bed, maybe it's become the A&E. It's become an extended waiting
In this
room.
report,
But if we do
Dennis,
rule it
thank
out, what happens?
we have to get
people stay at home or they stay stuck in an ambulance.
Policymakers in the NHS, the way it's organised,
The population is
has to
70 million
change.
people, and a significant percentage of them are over 65, 70.
Yes.
And they're living with comorbidities.
There's plenty of money in the NHS. It's just not spent in the correct way.
Oh, okay. We'll always say that.
And this is not me. This is doctors and nurses who I feel hellishly sorry for in this situation because they're not able to do their jobs properly.
Oh, well, I think we might be able to hear from a nurse now. Sue from Wiltshire, have I got this right? Are you a nurse?
Yes, I am.
Great. Corridor care, is this common practice?
Absolutely. Every shift I come on, our hospitals are full up and down the country. and it's the norm now.
Is it dangerous?
Very, yeah. The whole A&E is dangerous. A&E is no longer your front door anymore. It's a front door and a ward. We have to care for patients with the same ratio of staff. We often have to steal staff off already short-staffed wards to corridor nurse because we can't staff it enough. And patients, they're the lucky ones in the corridors. They're the ones who've actually managed to lie down. Many elderly, 90-year-olds, people with cancer, are waiting all night in our waiting rooms on hard chairs. And they're the lucky ones that have managed to get to A&E, managed to get a hospital.
Sorry, Sue, sorry to interrupt. If an edict came from on high, from Carole of the Department of Health or a minister, and said, this is banned, we can't do this anymore, what would happen, do you think?
It's not the answer. You can't ban it.
Yes,
but if we ban it, we haven't got enough beds.
But don't ask Sue for that. Don't ask Sue to solve.
No, but she's on the front line. She's on the front line.
Don't ask her to solve it.
She would have to deal with the consequences of your edict.
It is not her job to solve the problem of care in corridors. Yeah. It is the policymakers' job. It's the people who run the hospitals. It's the people who dole out the money.
But it's implemented by people on the ground.
Well, I'm so sad to have to finish this on such a worrying note, but amazing. Sue, thank you very much for calling in.